as part of the plan. So there's a status bar, so you guys will know where we are, and more importantly, how close we are to the end. You'll be able to see this status bar move across the screen on the bottom. So the first thing we had to do was we had to evaluate our mission and confirm our mission. So 96% of respondents, of stakeholders, agreed that our mission was properly stated as to accelerate stem cell treatments to patients with unmet medical needs. Furthermore, 100% of our board responding to this question also answered that this was our mission. So having a good, concise, crisp mission is a great place for us to start, because we will always orient towards that. Almost everything else is up for debate or discussion about how we're going to get there. But our mission can't be. This has to be our guiding star, the thing that doesn't move, that we never, ever, ever stop moving towards. So the fact that we have this kind of consensus, and I would just say at 96%, this isn't consensus, this is conviction. This is what conviction looks like. Around this mission, now we know exactly where we want to go. So how are we going to do there? What are we going to do? Well, it centers around creating this giant engine that I talked about. But clearly, if we listen to our stakeholders, there's more to that than just building this engine. So the idea here is we're going to exponentially, and these words are used intentionally, meaning we're not going to linearly climb out. We are going to exponentially climb out, advanced CIRM's mission by leading a coordinated campaign that holistically attacks the obstacles meaningfully affecting the speed, probability, and sustainability of stem cell treatments to help patients in needs. So it overlays nicely with our mission. Obviously, there's a lot of our mission in there, but there are some key things in here. One is lead. I've gone out and I've talked with a lot of people, a lot of other regenerative medicine institutes in other states and other countries, and they all look to us and they say, CIRM should be leading more. We are by far the largest regenerative medicine institute in the world. It's time that we start leading like we were. And by the way, everyone wants us to. So we're going to get into the leadership business a little bit more. This coordinated campaign, that means making all of our pieces not just fit together, but work together and pull in the same direction. Holistically attacks all the obstacles, everything that's in our way, that is in the way of a stem cell therapy reaching a patient, is going to be fair game for CIRM to go after. And then obviously the whole thing is about getting these treatments to help patients in need. So I'm going to use another analogy here. I obviously use a lot of analogies, but I like to do them because I think they can make sort of sometimes what can seem like concept or complex thoughts more clear and easily more easily understandable. And so here we have the way CIRM has existed, and that is, if we're going to use the analogy of CIRM is trying to push a giant boulder over a hill, and that giant boulder represents stem cell treatments. And on the other side is the valley of happiness, where our patients are who desperately need this boulder to be effectively moved over this hill and delivered to them. I don't know why we would want a boulder delivered to you, but just go with the analogy for a second. And what CIRM has been doing in the past is a very honorable job of pushing this boulder. And there's a lot right about pushing this boulder over the hill. So the first thing we're going to do, we have these strategic themes and specific actions. The first thing we're going to do is we're going to push harder and better. We're going to take all of our programs and we're going to line them up, and we are going to coordinate them all, and we are going to get good at them. We're not just get good at them, we're going to get great at them. That is, we are going to fully operationalize CIRM 2.0, clinical, translational, and discovery all working together in a coordinated fashion. We are going to open translational and accelerating centers that work together, that take that 8-year development time and squeeze it down and at least cut it in half. And we're going to focus our programs. And so we're going to be looking at things that where CIRM should be funding, the sweet spot for CIRM, demonstrating proof of concept in human clinical trials, meaning we have to look at the kinds of endpoints we're having in our human clinical trials, and we need to look at the types of human clinical trials that we are that we're partnering with. So the first part of the strategy is push, but not push as an individual or as an initiative, but push is a giant coordinated machine that can really get that boulder moving. Second part of our strategy is, if you look, there is nothing on the other side of that hill helping us here, right? And that just is flat out, there is not enough downstream demand that's currently engaged in the work that we're trying to do. If I had today a small molecule and a stem cell therapy that had exactly the same amount of data, that were at exactly the same stage of development, industry would partner that small molecule at 50-to-1 over the stem cell therapy. We need them involved, but we also need other pieces involved, right? It was really telling to hear that a basic, a researcher that engaged in basic or discovery research didn't know how to get a hold of and in contact with a translational researcher that could help take that program forward. So we're going to be launching something called the CIRM Exchange. Internally, we kind of joke around, it's like the Match.com. It's how do we have people downstream that are interested in this kind of work pull forward the great work from earlier stage researchers that have been funded by CIRM. We're also going to be looking, so CIRM has like 300 different programs. The vast majority of those have no partnership.